Good afternoon. My name is Jason Curtis. I'm an investment advisor representative of J. Curtis Wealth Advisory Services, a DBA for Lindley & Company, a registered investment advisor. I want to thank you for joining me for this very important topic. I especially want to thank Nic Monachino. Did I get it right, Nic?
You got it.
For joining us as well. Nic and the rest of Ahrens Benefits Company is a tremendous resource and partner to my firm. So Nic, from the bottom of my heart, thank you. Thank you so much for taking care of our mutual clients. I really appreciate it.
You're welcome.
We're going to mute all of the participants, but if you have any issues or want to ask a question, Nic did leave some time at the end of the presentation to do so, and you can unmute yourself at the bottom left-hand corner. I will also say that you should be able to raise your hand if during the presentation you have a question, you want to make sure you get it in, you don't forget about it, or it seems very timely and relevant, relevant. You can unmute yourself again in the bottom left-hand corner. It's a small group today, so don't feel like you need to hold your questions till the end. A couple disclosures before we get started. This presentation is a general communication being provided for informational purposes only. It is educational in nature and not designed to be taken as advice or recommendation for any specific investment product, strategy, plan, feature, or other purpose in any jurisdiction, nor is it a commitment from Lindley & Company to participate in any of the transactions mentioned herein. As this is not investment related, we can slide through the rest of it. All right. Office updates and announcements. I'd like to welcome Simone Scurry back to the team. Simone will be working Monday, Wednesday, Friday while I continue my search for our new full-time team member, client service associate, and office manager. But right now, Simone is taking on those roles, and I'm very, very thankful to her. Her contact information is right in front of you there. But if at any time for the rest of the year, if you have any issues, please don't hesitate to reach me on my cell phone. At this point, you all should have that number. Don't forget, on Wednesday, November 29th, that's the Wednesday after Thanksgiving. I can't believe we're there already. We have our Psychology of Investing seminar. It's going to be a good one. If you want to kind of look inside of our brains and dive deeper into what happens when a bear market occurs, and what kind of curveballs our mind can throw us when we are trying to stay invested for the long term, but this darn volatility keeps happening. It's going to be an interesting conversation, collaborative conversation with BlackRock Investments. Registration is required, so if you registered for this event on one of my blast emails, the link should be there in that same email for that registration for that seminar, but I'll also be sending out a letter to investors and office updates on Monday as well, before the Thanksgiving break. Holiday hours, we will be open Monday through Wednesday of next week, and then closed, obviously, Thursday. I will be on call Friday if anyone needs to transact, needs cash, needs to make a withdrawal or a deposit or place a trade, as Friday technically is still an open day for the stock market. Year-end checklists before I hand it over to Nic. Well, this is very timely. Medicare enrollment ends December 7th. Nic will get more into that, what that details, who it involves. But the tax deadline for things like maxing out your 401k, 529 savings, taking your required minimum distribution, or doing a Roth conversion ends on December 31st. So I've already reached out to a lot of you folks who have to, do, one of these things by December 31st. We've already discussed that, and for the most part, we're done with RMDs and things like that. But other things like assets that are held away, like your 401k, for example, you probably have about 3 more pay periods left to try to dump as much in there as you can if you're still working. And if you're unsure of what your max allowable contribution is, just shoot me a quick email, and we'll get to the bottom of that and make sure we're maximizing that benefit as best we can, within, obviously, feasible. And then the last day to transact before the year end is Wednesday, December 27th. So December 31st is a Sunday this year. Keep in mind that if you need to sell or place a trade, it has to be done within 2 days prior to that Friday. So if you have to transact or do anything before the end of the year, it really needs to happen on December 27th. Okay, so kind of bridging to our conversation today, I thought I'd share with you this slide. So retirement is typically comprised of several phases, and this sort of prosperous retirement profile was coined by an advisor named Michael Stein. And I think it's an excellent anecdotal illustration of what many experience. So the first decade or more in retirement can be quite active, or I hope it is, for most of my clients, as you're trying to maximize, if you've been fortunate enough to have good health, you're trying to maximize that as best you can in this kind of active phase, go, go, go. The phase gives way to a more passive or slow go phase when spending tends to decline in the age group of 75 to 85. And then the final phase sees lifestyle spending continue to decline while healthcare and long-term care expenses may rise significantly. And that's really at the crux of the conversation today. If you have a good healthcare benefits consultant or partner like Nic here, or my friends at Ahrens Benefits Company, really what we're trying to do is think preventatively and make sure you're getting all the care that you need during that go-go and that slow-go phase to try to maximize as best we can those good years, and also minimize that out-of-pocket expense in the later years. That's really at the crux of what we're talking about. And just to kind of put a bow on top of all of this, at age 65 in 2022, the average out-of-care Medicare costs in retirement was about $508 across the country monthly. If you compound that by 6% and then tack on this kind of uncertainties around health, healthcare inflation variability and Medicare solvency issues, there could be another premium there. But at a 5.6 or 6% clip, that $508 in 30 years is the equivalent of $1,475 inflation adjusted. So we do that for clients already. I'm of the mindset that you have to add that as an additional line item, because we're just not thinking about it. If we're a W-2, wage employee, those costs are already coming out of our paycheck, but we don't think about it as an additional line item cost that we have to incorporate in our retirement plan. So as you know, I already incorporate those that additional cost into the plan, and I do inflate it at 6%. If I need to increase it after today's conversation, then I will do so. But that is just a long and short way of saying thank you and happy Thanksgiving to all of you, my current clients, from my family to yours. Thank you and happy Thanksgiving. And with that, I want to turn it over to Nic Monachino, who's been in the business for 4 years. Prior to that, Nic has a diverse background in what he affectionately calls corporate America. When he's not working with his clients or busy with enrollment period, he is married and Ubering around his 9-year-old son and all of his activities. Nic, we've probably passed each other plenty of times on the road with me doing the same. And Nic is also, like myself, an avid golfer. Nic, thank you so much for taking the time, and the floor is yours, sir. I will be your Vanna White, so just let me know when you need me to change the slide.
All right, thank you. Really appreciate the warm welcome. I feel like you know me really well, Jason. That was quite the intro. Okay, So again, thank you for having me. I really appreciate the opportunity to talk to you folks. Again, my name is Nick, and I specialize in Medicare. So we are going to do our best today to talk through Medicare at a very high level, um, and hopefully get through some of the larger concepts that we feel are important to have a good understanding of as you kind of move into the Medicare world here. So a big part of what we do, I was talking with Jason about this, a big part of what we do is to try to take the confusion out of Medicare. There's a lot to know. And so our goal is to minimize the stress and uncertainty and the unknown of what Medicare can be. Um, as he mentioned, I'm from Ahrens Benefits Company. That's the name of our organization. We've got 2 locations. We're on the west side here in Greece on Dewey Avenue. And we also have an east side location at Linden Oaks. So convenient for either side of the city. As I mentioned, we specialize in Medicare. We also do other things with other insurances, but Medicare is really what we specialize in and try to stay focused on. Me personally, I only work in Medicare. So working with me, that's the only thing that I do. That is my specialty. So just wanted to mention that as well. Okay, Jason, next slide here. So you can skip this. Honestly, I mentioned this already. A big part of what we do is try to take the confusion out of Medicare. So that's all that slide was alluding to. So I'm going to start off by just talking about the major components of Medicare. So I'll start from left to right here. Part A is what we refer to as hospital insurance. So if you end up in the hospital, the portion of Medicare that will cover that is what's known as Part A. Part A typically is no cost for most citizens, as long as you've worked in the U.S. for at least 10 years. Part A does not have a cost associated with it. Part B is what we refer to as medical insurance, more commonly known as office insurance. Essentially, what that's covering is when you go to your primary care physician, if you go to see a specialist, or if you need any outpatient services like an outpatient surgery or something of that nature, that's what Part B covers. Part B does have a cost associated with it. Part B currently is $174.90. I should say it's $164.90 in 2023. The government just recently announced that it's going up to $174 in 2024, which is right around the corner here. So important to note, Part A and Part B are issued by the government. Okay, so that is not insurance that you can get from a private insurance carrier. That's issued by the government. So that's an important piece to note. Oftentimes, when people talk about Part A and B, you'll also hear people refer to that as original Medicare. So if you ever hear that term, people are referring to Part A and Part B. Moving along here, Part D is prescription drug coverage. So think D for drugs. As we kind of move through this alphabet soup here, that hopefully is a little intuitive. Part D, as you know, you can guess, it covers your prescriptions. So that insurance is offered by private insurance carriers. It is not offered by the federal government. So seeking prescription drug coverage, it is required, but it's not offered by the government. That is something you have to seek out from a private insurance carrier. Lastly, Part C. Part C, also known as Medicare Advantage, that I would assume is something that folks are familiar with just from a terminology standpoint, because there's a lot of commercials this time of year on TV and on the radio. A lot of what they're referring to is Medicare Advantage. Medicare Advantage is the easiest way to think about it is it's a bundle. It bundles together Part A, Part B, and Part D. So your hospital insurance, your medical insurance, and your prescription drug coverage. It bundles those three items together into one nice, neat package. The other piece that's important to note about Medicare Advantage is, like prescription drug coverage, it is only offered by private insurance carriers. So as folks, it's a very common and popular Medicare product. When folks decide that Medicare Advantage is what they want, just have to be aware that they're no longer being insured by the federal government. That insurance is now transitioned to a private insurance carrier. And we'll talk about who some of those players are as we move along here. Next slide, Jason. Thanks. So as I mentioned, Part A is free for most folks as long as you or your spouse worked at least 40 quarters throughout your lifetime. So a little bit of a repeat there, but just again, as far as cost goes, which obviously you want to keep an eye on as we move throughout here. That's obviously one of the biggest questions that we get. What does Medicare cost? Your Part A coverage has no cost associated with it, as long as you or your spouse work for at least 40 quarters. Next slide. Part B, we talked a little bit about this already. As we mentioned, $164.90 is the current cost for that. It was just announced within the last couple of weeks here that in 2024, that is going up to $174. So again, something to be aware of. And then also, as you can see here on the slide, if you're collecting Social Security, Part B is automatically deducted from your Social Security check. So they do that automatically for you, and it comes out monthly. So essentially, whatever your Social Security benefit is, it's reduced by that Part B cost. If you are not collecting Social Security and you are on Medicare, then they will send you a bill. An important thing to understand about that aspect of it is if you are billed, they are going to bill you quarterly. Okay. They do not bill monthly. So that's something to be conscious of, because especially if you're new to Medicare, you're hearing, oh, okay, so it's going to cost me $174 per month. And then you get that first bill and it's that 174, times 3 months. As you can imagine, I get phone calls like, regarding that from my clients saying, what happened? You told me it was going to be 174. It's a lot more than that. And then I got to remind them that, hey, it's a quarterly bill that's going to cover you for the next 3 months. So that's just something to be aware of. Next slide, Jason. Thank you. So what this slide is referring to is Part B IRMAA. So IRMAA is Income Related Monthly Adjusted Amount. That's what that acronym stands for. Essentially what it's saying, it's a fancy way of saying that your costs for Medicare increase for high income earners. So the standard rate is going to be that 174, as we mentioned, but that does go up as income goes up. So depending on how you file your taxes, single or joint, will determine the income thresholds. But as you can see there, that first threshold for if you're filing single, anything over 97,000 annually in income is going to have an elevated Part B and prescription drug cost, Part D. So those are referring to the monthly premiums that are associated with those products. If you're filing joint, anything over that 194,000 is that first threshold where the monthly premiums start to increase. And then you can see there is the chart there. Each threshold has a different premium associated with it. All the way up to that last one, that's where you would max out. So that's IRMAA. So just keep in mind, if you earn over these thresholds here, the cost will go higher than that standard $174. Next slide.
Thanks, Nick. I just wanted to say, so we'll generally, work with clients to make sure that we are doing the best that we can to stay within the, what was it, 173.90 next year?
Mm-hmm.
But there's, obviously situations where if you're getting a pension, your Social Security, maybe required minimum distribution, some other business, entity income where it's, unfortunately unavoidable to be in that 230/80 range.
Yeah, thank you, Jason. What Medicare does not cover. So I won't talk through all of these. Some of them are pretty expected or intuitive, I guess you say, like cosmetic surgery, right? But a few things that people might think are covered, but are not covered. The first one I'm going to mention is long-term care. So, insurance for covering, if you're going to a nursing home, that is not covered under Medicare. That's a totally different type of insurance. Dental coverage, vision coverage, and hearing coverage, that is not covered in Part A and B, the parts of original Medicare. We do work with our clients to obtain that coverage. It is covered in Part C, that Medicare Advantage that we refer to. So when we talk about, why that's such a popular product, many of our clients, look for those particular coverages, dental, vision, and hearing, as a reason why they're looking for the Medicare Advantage piece. And then a few other things there that are not covered. We can move on to the next slide. Okay. We're going to talk about the two different paths that you can go on to supplement your Medicare coverage. So as I mentioned, Part A and B is the standard original Medicare that's issued by the federal government. Once you have those, you then have a decision to make which route you want to go to supplement that insurance. One route we've already talked a little bit about, that's Medicare Advantage. So you can choose to go that path. The easiest way I can describe that is it is a low cost, quality insurance where your insurance are copays. So as you go for medical services, there's a fixed fee associated with each of those services that you are paying when you go get that service. So Part C, the easiest way to consider that is low monthly premium with copay type coverage. And again, Medicare Advantage will include dental, vision, hearing, and your Part D prescription drug coverage, the required components of your health insurance. So that's one route. Another route you can go is something known as Medigap. So that's on the left side of the screen here. Medigap is not as common, but there is still a place for it. It's a product that we offer, and we also specialize in that. I'll talk through the strategy there a little bit without going into too much detail, because we're going to go into that a little bit later. Medigap is high monthly premium. Okay, so kind of the flip side of the coin of your Medicare Advantage. It's a high monthly premium, but your health costs, your health services, I should say, are covered in full. Okay, so when you go to the doctor, a specialist, or you go to the hospital or anything of that nature, there's no out-of-pocket expense there. For the most part, that's covered in full, and the cost that you have is essentially going to be that high monthly premium. So again, there are some details that are in addition to what I just described. I'm trying to relay it at a very high level, but that's the high level concept. Couple things to be aware of with Medigap. Number one, it does not include prescription drug coverage like Medicare Advantage does. So it's important to be aware of that. You have to go get that as a standalone product. Okay. Second is Medigap does not include dental, vision, or hearing coverage. So again, if you want those insurances, you would have to get those as standalone products. And again, in contrast to that, Medicare Advantage bundles all that together in one. So Medigap, how is that deployed? What's the strategy behind that? Again, without getting into too much details, the clients that I work with that are interested in Medigap the Medigap product are clients who have a serious diagnosis. As you can imagine, with a serious diagnosis, the frequency of your services that you need from a medical standpoint are much higher, right? So when all of those services are covered in full through the Medigap policy, you can really justify that high monthly premium for that product because financially it makes sense, right? Prime example of that is, if you have a cancer diagnosis, or, dialysis, things of that nature, where you are going for frequent treatments that have, a higher cost. The Medigap policy is going to cover those services in full, which will really help justify that high monthly cost that you experience with Medigap. So again, as you kind of think about, well, what coverage might work best for me, or how do I decide which path to go down? Those are some things that our clients think about and some things that we talk through with them to kind of help them determine which path makes most sense for them. Okay, next slide, Jason. So just briefly here, just some things to talk about. I always laugh when I see this kid with his hands, buried in his face buried in his hands. It reminds me of my son. But a few things to think about when you are making your decision regarding Medicare. So number one, do you have other coverages that are working in conjunction with Medicare? Prime example of that is veterans, right? So if you're a veteran, you might have VA coverage, right? Which is insurance that's being offered for your services to our country. There are Medicare plans and products that work in conjunction with that. Again, that's something we talk through with clients. Costs, right? That's an obvious one. What's my monthly premium? Is it low? Is it high? What am I getting for that? Are there deductibles involved, right? Deductible meaning what you're paying out of pocket until the copays kick in. That's what a deductible is. You're essentially paying out of pocket before the plan starts to work. Copays, right? That's the scheduled fee that is in place for any medical service that you might need, so you know that ahead of time. And then coinsurance, similar to copay, it's something that's scheduled and in advance. It's a percentage. So what percentage of the bill will the plan cover? What percentage of the bill do you have responsibility for? So when you hear coinsurance, that's what that's referring to. Doctors and hospital choices, are they in the network for the plan that you're considering, right? When I say in network, meaning does the carrier that you've selected, does your doctor and the hospital that you visit, are they considered in network? That's one way to keep your costs lower. Prescription drugs, how are those being covered? Each plan is different. So which plan is going to cover you best for your prescription drugs? Some of that will just depend on what prescriptions you're taking. Quality of care, convenience, whether you spend part of the year in another state, right? So if we have folks that do a lot of traveling or spend, part of the year, the winter months, maybe in a warmer climate, these are all factors to consider as far as what type of plan we may want to discuss with you. And again, as part of our services here, those are things that we touch on during our consultations to make sure that we're putting you in a plan that's the right fit for you. Okay. Yep, you can move on. And so we're going to talk a little bit deeper about Medigap here. We can go on to the next slide here, Jason. Thank you. So Medigap, some of this will be a little bit repetitive. We've talked a little bit about some of these concepts at a high level, but I'll go through them again here. So Medigap, it is just what it sounds. It's gap coverage. So original Medicare will cover 80% of your medical costs, right? So when you get a bill for $100, original Medicare is going to cover $80 of that. $20 of that is going to be something that you're responsible for simple math here. What Medigap does is it essentially fills in that 20% gap, right? So when I say when you're on a Medigap plan, typically the majority of the medical services that you are getting are covered in full. It's because they're covering that gap. Okay, that's how the concept goes. They all have a monthly premium. Typically, they're going to be much higher than what you would experience under the Medicare Advantage. We talked a little bit about that. No network. So network, again, as I mentioned, each carrier, each insurance carrier has a network. It's a group of medical providers that they have partnered with to say, yes, we will take that insurance. Okay. What's nice about Medigap is there is no network. So you can essentially go wherever you want. Essentially, anybody who accepts Medicare is considered in the network. So you can go use your Medigap policy. So that really gives you a lot of freedom. I also mentioned the next bullet there, which is it works well for chronically ill or those who don't want a network, right? Obviously, we talked about there is no network, but we also mentioned those who have, serious diagnosis. And then lastly there, again, a bit repetitive, but you do have to pick up a separate standalone prescription drug plan if you decide to go the Medigap route. Next slide. Thank you. I'll briefly touch on this. This slide can be a little confusing and a little busy, but what I just want folks to understand here is that Medigap has several different products, and they're all designated by a letter, A through N there. So essentially, each letter is going to offer a different type of coverage. What's important to note, though, is while multiple carriers will offer these Medigap policies, so what I mean by that is your Excelluses of the world, your United Healthcare, Humana, Aetna, the list goes on, right? All those carriers can offer all these various Medigap policies, but what's important to note is that by law, they all have to offer the exact same coverage for the Medigap policy. So if someone from Excellus is offering Medigap Plan G, that coverage will be and will work exactly the same way as Medigap Plan G under United or under Aetna. They have to be what's called uniform. Okay. So that's a concept that's really important to know. Why is that important? Because once we understand that the coverage is exactly the same, regardless of which carrier we're going with, then it comes down to cost as really being the only variable, right? So from a monthly premium perspective, that can vary, right? So you'll have one carrier that's offering a Plan G for $400. You'll have another carrier that's offering that exact same coverage Plan G for $290. And that's a real life example. Like that is currently happening in the marketplace. So we are obviously talking our clients through that and explaining to them that the $290 Medigap Plan G is going to work exactly the same way as that $400 one is. So, don't waste your money essentially, right? Make sure we have a good understanding of, at this point, it's really just about the variability with the cost. So that's what's important to note about this slide. Supplemental plans in New York. So there's no underwriting. So what does that mean? If you are the perfect picture of health, or if you're on the other end of the spectrum where you might have a serious diagnosis or a chronic illness, and then you have everybody in between. What's important to note is when there's no underwriting, essentially what we're getting at there is there's no cost difference. So that $290 policy is going to be the same exact $290 for someone who's perfectly healthy or someone who's sick. So they don't go through your background or your health history when you're applying for this product. If you want it, it's available to you in New York State. In addition to that, as you age, that does not change the premium either. So again, if you're 100 or you're 65, the price is the same. So that's just something that's worth noting. The reason that's important is because right now you might be in fairly good health, and maybe Medicare Advantage makes the most sense for you, right? Low cost and quality coverage. But as you never know what the future holds, right? So as you get older, or perhaps your health condition changes, it might become a situation where the Medigap policy now makes more sense to you. What we're trying to relay here is that you do have the ability to transition to that when that change takes place, right? So when that serious diagnosis takes place, or as you get older and your the frequency of your medical needs has increased. So that's that. Next slide, Jason. Thank you. All right, we're going to talk a little bit about Medicare Advantage. So we covered Medigap, Medicare Advantage. We're going to dig a little deeper here, so we can move on here for the next slide, Jason. Thank you. Okay, so again, we talked a little bit about some of these items at a high level. I'll briefly touch on them again here. So Medicare Advantage is offered by private insurance carriers. It's not offered by the federal government. So once you made a decision to move to Medicare Advantage, your coverage is now gone from the government into the hands of a private insurance carrier. They must offer the same benefits as Part A and B of original Medicare at minimum. So essentially what they're saying is that original Medicare that's offered by the government, if you're going to offer a Medicare Advantage product, it's got to be at least as good as the coverage that the government is offering, which again, as a reminder, is that 80-20 split. Okay. Each type of service may have a cost sharing associated with it, right? So again, we're talking about deductibles, co-payments, and co-insurances. So again, that's talking about the cost that you would be responsible for when you go to get medical services. Okay, moving along. Many offer prescription drug coverage. We talked a little bit about that too. Again, that's bundled into the Medicare Advantage product. So you don't have to go pick up that standalone prescription drug coverage like you do with Medigap. Medicare Advantage bundles it together. Those plans are known as MAPD, Medicare Advantage and prescription drug coverage. Many offer additional benefits. So some of the fringe benefits that we like to talk about with our clients is, the dental, vision, and hearing. That's obviously a big piece of it. Some lesser known pieces to it are oftentimes they come with a gym membership. And those gym memberships will typically be for many of the major gyms in the Rochester area. So the question that I get the most is the Y included in that? Yes, the YMCA is included in that. There's something called a Part B give back as we talk about additional benefits here. Some plans with Medicare Advantage will say, if you enroll in our plan, we will pay for a portion of your Part B cost. So remember that Part B cost is $174 in 2024. Some plans will say, we'll help pay a portion of that. And then lastly here, they have a network of providers, okay? So again, that concept is essentially each carrier has contracted with, a group or a network of medical providers. When you see those providers, you're going to achieve the lowest cost. When you go outside of that network, the cost will be a little increased. Yeah, we can move on to the next slide. Okay, as we talk about carriers, you've heard me use that term a lot. What you see on this page are some of the major players in the Rochester area that offer Medicare Advantage plans. So I'm assuming many of these are familiar with you as you have gone through, your work career. You may have been insured by some of these. Excellus and MVP are the two local carriers. And then you have some others that are national carriers. So for example, like Aetna, United, Humana, those are national carriers. So as you go outside of the Rochester area, people have heard of United, Aetna, or Humana. Okay, next slide. So this one I'll touch on briefly. This is kind of our PSA, our public service announcement. We use Joe Namath as a example, but there's plenty others. Especially this time of year, you're seeing all kinds of commercials where they are pitching Medicare Advantage, and all the various products that go along with that. They all have a toll-free number you can call. They all offer you the world. I mention this because, just as a word of caution, what these places are not going to do for you is they're not going to give you a consultative approach. They are not going to talk through your specific needs. They're not going to talk through your history. They're not going to talk through, what prescriptions are you taking? What doctors do you see? Are they in the network? Who's going to cover you best? So I just mentioned that as a word of caution because they may end up, and oftentimes they may put you in a plan that might not be suitable for you based on the fact that they're trying to just churn through enrollments. So you may spend 5-10 minutes on the phone with these folks and end up enrolling in a plan that might not be great for you. In contrast, brokers like our company here, at minimum, we're meeting with clients and we're spending at least an hour with folks. Anything less than 45 minutes to an hour, it's hard to say that you really have a good understanding of what type of plan that person might need. So I don't want you to feel like it's some long, exhaustive process, but at the same time, I do want to make sure that I'm relaying that you do want to make sure you're taking the time to talk through what's important regarding the coverage and your personal situation to help get to the right decision. So that's just a word of caution. We can move on, Jason. All right, let's talk about prescription drug coverage. We can go next. So there are two ways to get prescription drug coverage through Medicare. We've talked a little bit about both. I'll just highlight them again. First, if you are on Medigap, you have to get what's known as a standalone prescription drug plan, right? It's not built into the Medigap plan, so you have to get what's known as a standalone prescription drug plan. Essentially, what that means is it's another insurance policy that only does prescription drugs, and you add that to what you have with Medigap. The second way that you can get prescription drug coverage is if it's bundled into Medicare Advantage. So if you decide that Medicare Advantage is right for you, then typically that prescription drug coverage is bundled into that. Next slide. Okay. How does that prescription drug coverage work? So whether you're on a standalone plan or whether you're on a prescription drug plan that is bundled into the Medicare Advantage coverage, they all work very similar. Okay. So across Medicare, prescriptions are placed on a tier system. That's tiers 1 through 5 typically. Your tiers 1 and 2 are going to be your low-cost generic prescriptions. Oftentimes, the coverage for those through Part D is covered in full, or it could be a low copay, a small copay, $12, $15 or less. When you get to tiers 3, 4, and 5, you're talking about your more expensive drugs. Oftentimes, it might be a brand name drug where the patent has not worn off yet. If one of your prescriptions are a tier 3, 4, or 5, you are subject to the plan's deductible, which means you're paying out of pocket for that prescription until you've met the deductible. Then the copay kicks in. And those copays are typically going to be elevated higher than obviously your tiers 1 and 2. This is important to know because each carrier offers coverage for prescriptions in a slightly different way. Each carrier has what's called a formulary. A formulary is essentially a list of prescriptions that carrier covers and what tier they're on. Each carrier has a different formulary. Why is that important? Because part of our approach is let's talk about your prescriptions and let's see which carrier is going to give you the best coverage. So what you might find is you have one carrier that has your prescription that's listed as a tier 3. And then you might see another carrier that has that exact same prescription listed as a tier 2, so lower costing. That's obviously a benefit for you. That's part of the process that we go through. Okay, so just want to make sure you're aware of that. Next slide, Jason. So this slide is referencing assistance. Prescription drugs can be expensive for some folks in our community. Some folks, it's no big deal. They might just be on generic prescriptions where it's low cost. Maybe they're even covered in full. But for others, they might have something serious that they've been diagnosed with where they're taking some drugs that are expensive, and it might put a financial burden on them. What we want to make sure that our clients are aware of is there are several programs that are out there that offer financial assistance for clients that might be going through that situation. There are 3 listed there. You can go right through Medicare and Medicaid directly. They offer some assistance. You could go through Social Security. They can also talk you through what programs are out there. And then the last one is Epic, which is specific to New York State. They offer some assistance for pharmaceutical insurance too. If it's relevant for any of our clients, which obviously we can kind of tell right out of the gate here when we start going through their prescriptions, we obviously want to make sure that we're talking with them about that to see if there's a program out there that might offer them some relief. You can move on. Okay, how are we doing on time here? Not bad. So when can I enroll in Medicare? So first things first, obviously when you turn 65, you become eligible for Medicare. But let's say you turn 65 and you've declined Medicare because maybe you're still working and you have access to health insurance through your employer. In that situation, you can enroll in Medicare when you then go to retire, and you may no longer have access to that employer coverage, right? So at that point, you're past 65, you are not on Medicare, and you're retiring. That's obviously going to be an opportunity for you to enroll in Medicare as well. And then the last one, which is less common, is folks who might be on disability. Believe it or not, if you're under 65, you can get Medicare if you've been deemed disabled for 2 years straight. You become eligible for Medicare. Okay, how do we enroll in Medicare? If you are already collecting Social Security and you're approaching your 65th birthday, it's an automatic process. The federal government automatically enrolls you in Parts A and B, okay? If you are in that boat, the timing of that will be the 4th month prior to your birth month. Okay, so as you're approaching 65, you're going to start getting stuff in the mail from Medicare that's going to say, hey, you're approaching your 65th birthday. You are currently collecting Social Security. We're enrolling you in Medicare Parts A and B. Doesn't mean you have to take it. You can decline it, but they do automatically enroll you. So it's important to be aware of that in case you do want to decline it. Let's say you are over 65. Well, actually, before I do that, let me finish up here. When does coverage start in that scenario? Coverage is going to start on the 1st of your birth month. So if you were born in November, for example, on November 1st, that's when that is going to go into effect. If you were born on the 1st of the month, they actually retro you back to the prior month. So in that same example, let's say you were born November 1st, you would actually become Medicare eligible October 1st when you turn 65. Next slide. How do I enroll in Medicare if I'm not collecting Social Security, right? So if you're not collecting Social Security, it's not an automatic process. So what do you do to go through that? The easiest way to do it is online. You can go to ssa.gov. Some of you folks may already be familiar with that website. That's the same website you'd go to see your Social Security benefits. As long as you have a login and if you have credentials for a username and password, you will have the ability to go there and also enroll online in Medicare. So that's one way you can do it. So if you're computer savvy and you're comfortable doing that, you can go online. The other option is you can work directly with Social Security. So there are several Social Security offices in Rochester. You could visit one of them or call one of them to go through that process as well. So you have 2 options there. If you can go through the online version, I will tell you it's much more streamlined. But again, that's not for everybody. So there is another option by working directly with Social Security. You can move on. Thank you, Jason. Okay, so let's talk about what's known as the initial enrollment period. So again, we're approaching our 61st birthday, let's say, for example. they're going to give you a 7-month window that's referred to as your initial enrollment period. That's the window in which you can enroll in Medicare. So that 7-month window, what does it consist of? Well, one of those months is the month that you were born, right? The other 6 months are the 3 months prior to that month, your birth month, and then 3 months after your birth month. So that's where they come up with that 7-month window. I always recommend to clients that your best bet is to take action in those first 3 months. If you do that, they can guarantee that they will have your coverage in place for the first of the month of your birth. If you wait till after your 65th birthday and you move into those 3 months after that, there's no guarantee. They kind of get to it when they get to it, so you don't exactly know when it's going to start. Essentially, they'll reach out once it's been processed and let you know when that date will be. On average, that can take 4 to 8 weeks. So that's why I always say if you can get it done prior to 65th birthday, that's to your advantage. Thank you. Okay, Medicare and employer coverage. So if you are 65 and you are covered by an employer, so let's say you're still working, as I mentioned before, you can decline Medicare. So you can choose not to pick up Medicare, but there are some caveats to be aware of as to when you're allowed to do that. One of them is what they refer to as you have to have what's called creditable coverage. Okay. So if you're employed and you're over 65 and you decide to decline Medicare, in order to do that without any type of penalty, you have to make sure that number one, your employer has more than 20 employees. As long as that's the case, it's considered creditable coverage. And the second piece of that is that the coverage that's being offered to you by your employer is at least as good or better than Medicare. As long as those two conditions are met, you can decline Medicare. You do not have to pick it up. You might find that your employer coverage is better and you may want to continue on that. And that's totally fine. Next slide. Thank you. Okay, I'm retiring and I'm older than 65. Now what are we doing? Well, if you're older than 65 and you're not getting your insurance through an employer, then Medicare is your only other option. Okay, so you must now start to think about working through the Medicare process. So if you haven't picked up Part A and B, you would want to go through that application process. Again, you can go online, or you can work with Social Security directly. What we have noted here that if you're in that scenario and you're approaching retirement and you're going to be losing your employer coverage, you want to make sure that you're giving yourself a couple months in advance of your retirement where you'd be losing that coverage to apply for Medicare. So we always suggest to folks 3 months in advance. So, if you're retiring in June, you might want to start thinking about starting the enrollment process for Medicare maybe in February or March, for example. If you only need Part B, it's the same thing. You can go online or you can just mail or fax in the application. And we've already talked about Social Security. Going there, you can apply in person or over the phone. Okay, next slide, please. Okay, Medicare coverage steps. What do I need to do? So what does the process actually look like once you've made the decision that you're going to go to Medicare? So step number one is you got to pick up Part A and Part B. That's kind of your ticket to the dance. You got to have Part A and B. Those are required components. Okay, so that's going to be your first step. And again, that step is being taken through Social Security. Okay. Step number two is what type of coverage would you like to supplement original Medicare with? Is that going to be Medicare Advantage or is that going to be Medigap? Again, that's a personal decision that you're going to want to make in conjunction with somebody who is knowledgeable with Medicare. Obviously, our company offers that service. So we're happy to meet with anybody who might be facing that decision and need some help kind of determining what might work best for them. And then the last step is, regardless of whether you go Medigap or Medicare Advantage, then it's a matter of, okay, which carrier, so which insurance carrier are you going with, and which plan are you going with that they offer. And again, that is something that we work with our clients. So step one, you're going through Social Security. Step 2 and 3, that's where our company or a company like ours would step in and help with that. Annual enrollment period. Jason alluded to this earlier. It is currently happening. This is our busy season. I'll tell you personally what I'm doing is meeting with each of my clients one-on-one to talk through, hey, has your medical condition changed? How has the plan that you're on been treating you? Are you looking to make a change? Do you want to stay put? Are you on any new prescriptions, seeing any new doctors? Let's talk about it all so we can make sure that you're making a healthy decision for next year for which plan you're going to be in. So during annual enrollment, you have the opportunity to switch to a different plan. So if you want to go to a different Medicare Advantage plan or a different Medigap plan, you have the ability to do that. Or if you want to flip between Medicare Advantage and Medigap, you can do that as well. So again, what we're doing right now is working with all of our clients to see if what they have is working or if they're looking to make a change. And obviously, the steps that we take to do that is, prescriptions, doctors, what's going on with you medically, what do you have upcoming, procedures, surgeries, things of that nature, and then, working through what might work best for you. Call your agent for help. Okay, so annual enrollment is what we just talked about. That period goes from October 15th through December 7th. There is another enrollment period that happens after the turn of the year. So January 1st through March 31st, there's another enrollment period in which you have the ability to move again if you wanted to. I kind of call this a little bit of a trial period almost. So if you made a decision during annual enrollment and now you're on a new plan January 1st and you go through January and maybe February and you've decided, oh, you know what, like there were some things that I didn't realize, or maybe your situation has changed. You can always reach out to your agent and we would have the ability to change you again or change you back. So that's why I refer to it as a trial period, because you might, test the waters with a new plan for the first couple of months and decide it wasn't for you. We have the ability to make a change for you. So that's another enrollment period at the beginning of the year that you should be aware of. Special enrollment periods. So these take place throughout the year. A special enrollment period is essentially a time in which you're able to enroll in Medicare or change your current Medicare election when you're outside of the annual enrollment periods. Okay, so let's talk about some examples of those. Let's say you move, right? If you move to a different county, you're going to find that the offerings there as it relates to Medicare Advantage and Medigap are different from the county that you're moving from. So that's one reason a special enrollment period would apply. Let's say your plan is no longer available, or you're losing employer coverage, right? We talked about that too. Like, let's say you've decided to retire. That's a special enrollment period in which you have the opportunity to take action on Medicare. And then there's several others that are available. Those are some of the most common ones. Penalties. So there are penalties that can be assessed if you are not covered. Okay, so the federal government wants you to have health insurance. If you do not have the required components, they will penalize you. The penalties that they add are lifetime penalties. So you got to make sure you're being careful. Part B, if you go without medical insurance for over a year, they will increase your Part B. Remember that $174 standard rate. They'll increase that by 10% for each year you are without coverage after 65. Okay. For prescription drug coverage, for every month that you are without coverage, they increase it by 1% of the average prescription drug cost. So you got to be careful. I tell clients, it's not anything you need to be worried about as long as you have a good understanding of the steps that you need to take as you go through this process. And again, that's what we're here to help you through. So again, as you're retiring, you don't want to have a gap in your coverage, mainly because you want to make sure you're insured. But in addition to that, you don't want to have a penalty assessed. Okay, how can our team help? As I mentioned, we take a consultative approach for anybody who is looking for information regarding Medicare. That can show up in a lot of different forms. You might be turning 65 and be new to the process. We can help. You might be older than 65, but retiring and transitioning to Medicare. We can help. We, again, will take the time to talk you through the process. We will also take the time to get a good understanding of your personal situation to help you make the right decision. The decision is yours. It's not ours. I tell people I'm kind of like the tour guide, right? So like I'm going to help you navigate through the waters, but at the end of it, you have a decision to make. And hopefully by time we've gotten through everything, you feel empowered to make the right decision. So that's kind of how our office helps. So we work with Medicare Advantage and we also work with Medigap. So regardless of what path you decide to go down, we can help with either of those. Okay, that's my spiel. How did we do on how did we do on time here? Not bad.
Timing was pretty good. This is no knock on Jane or Tina, but honestly, Nick, that was pretty clear, and it's generally a topic that is not always. So thank you.
Yeah, you're
if
welcome.
anyone wants to unmute themselves and ask a question, the floor is yours.
I don't have any questions, but I appreciate the time, and yeah, I found that pretty informative.
My pleasure. You're welcome.
All right.
Yes.
So yeah, go ahead.
I'd like to second that. This is such an unclear area, and
Yeah.
I'm coming away from this with a great understanding. So thank you.
Good feedback.
You know what? Honestly, I feel like those are some of the best compliments that we can get. You know, that's what we set out to do every time we sit in front of clients. And so I really appreciate that feedback. If folks have additional questions, or you think of a question later on, you can always call us. Our office number is there. You can ask to speak with Nick. I'm happy to help. Similar to Jason, you know, my clients have my cell phone number so they can reach me anytime they need to. So that's my approach in case you're curious. You have direct access to me, but you guys are very welcome. It was a pleasure, you know, getting in front of you and talking you through it. I'm glad to hear it was helpful. And you know, Jason, you've got my contact information. If anybody needs to reach out, you can go through Jason, and I'm happy to help.
Awesome.
Appreciate that.
Since it is past 2 o'clock already, I'm going to go ahead and end this presentation. And if anyone has any questions in the interim, or you think of something afterward, please feel free to email me, and then I'll loop Nick in, and then we'll get on the same page. I know some of you have some decisions to make, not necessarily this year, but coming up. So we will certainly revisit with Nick all of these different concepts if you decide to go with Ahrens Benefits Company. So with that, thank you so much to everyone. Stay dry.
Terrific.
And happy Thanksgiving.
Thanks, everybody. Thank you.
Thank you.
Bye-bye.